It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
And hi again, everyone. Jim Knox along with Grace Sells, and we welcome you back to another edition of the Best Docs Network, featuring, of course, some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And Grace, speaking of helping change people's lives, why don't you get the show started with our first doctor?
Yes, today up first on the show, we're going to hear about some non-surgical options for aging skin with Dr. Naila Malik.
Aging is a multi-dimensional process which starts in the surface and involves subsurface structures, including skin, fat, muscle, and bone. So the way we determine the best treatment for anybody's aging face is by looking at the extent of aging they have in each one of those layers. The CO2 laser will address your skin surface problems like texture and fine lines and deep lines and some collagen and elastin production. The radio frequency will address the skin tightness below the skin, and then you can use dermal fillers such as Radiesse or hyaluronic acid fillers to account for the loss of fat that occurs with aging as well. It is important to know what your patient needs based on their face shape and the type of aging you have. When I saw Jennifer, she originally came in asking for an option of a filler for her fine lines and deep lines above the lip and nasolabial folds. But after examining her, I determined that the CO2 fractional laser was probably the best choice for her. And she had the added advantage of having a tremendously great response to the CO2 laser by improving her elasticity.
My only knowledge of cosmetic procedures was filler and Botox. And I was told that I would probably need a facelift a few years ago by someone else, and I was dreading the thought of going under the knife, and that wasn't for me. So I was very thrilled when she told me this is basically a facelift. And sure enough, I had it 5 days ago, and I am absolutely thrilled with the results. And what's even more exciting, she says the results are even better as you go a few months down the road. So I'll continue to see improvement. I am completely blown away that for as simple of a procedure that it has completely changed my life.
The response of each individual patient to these treatments is very, very different. It depends on their genetics, on their lifestyle, and so many other things, the amount of stress they may have at that time. So you cannot really have a cookbook that every patient is going to need the CO2, radiofrequency, and dermal fillers, even if they look the same at the first visit. So you really have to step back and look at their results and see how the results show up over the next several weeks before you decide to do a second treatment.
When a patient comes into the clinic, I want them to feel very welcome. I want to have a clinic that's a nice, warm, inviting atmosphere. I want to treat them as I would a family member, my own family member. The first person they see is Sonia. She's the receptionist, office manager, kind of the patient go-to person for any needs that they might have. She's always makes it a point to welcome every patient, make them feel invited, make them feel comfortable, and let them know that she's there for anything outside of the medical treatments that the patients might need.
We really do like to get to know our patients as much as possible on a more personal level so we can individualize their treatment plan and help them in any kind of recovery process in order for them to be pain-free and make it as smooth as possible.
The second person that a patient meets is my nurse, Kelly. She's very instrumental in the treatment process for me. And then she's very instrumental in the backside of things, and so is Sonia. Kelly's very instrumental in the post-operative or the post-treatment plans. She's pretty much the go-to person to talk to when patients have any issues whatsoever post-operatively.
Through my
professional experience. I'm trained to care for all of his patients in the pre-op and the post-operative setting by providing education and what to expect during their visit, during their surgeries, and then also in their post-operative care. Initially, when I meet with Dr. Williams' patients, I review their history, their major complaints on why they've chosen to come to Dr. Williams in order to provide the absolute best information that I can for Dr. Williams to perform the surgery.
When patients come in, they may have a lot of questions about their pain and treatment options, and we are always here to answer any questions that they have.
From the moment a patient walks in my door and they meet me, I want them to understand that I'm going to take the time, do what it takes to get them from the point they are when they meet me to a point where they're 100% pain-free, no matter how long it takes.
Hi, I'm Dr. David Azouz with Best Docs Network. Today, we do liposuction on all parts of the body, including the abdomen, the thighs, the knees, the arms, the neck, the face. If you are interested in more information, log on to bestdocsnetwork.com.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. Specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
Acid reflux is a common condition, and you may already be on medications for heartburn. The trouble is, heartburn is only a symptom of the underlying problem, and taking medications to cover up the problem does nothing to correct it. Now there's a new procedure that restores the natural valve structure, keeping food and digestive enzymes out of the esophagus. You could stop the heartburn and the regurgitation, as well as the medications you've taken for years. For more information, call for an appointment or log on to dallasreflux.com.
Keeping your social networks alive and well may help benefit your ticker over the long term. Social support has been linked to a lower risk of heart disease, and people who do have heart attacks fare better if they are socially connected. Did you know that you can request an appointment with any of the amazing doctors that you've seen on our show today? Just head to our website, bestdocsnetwork.com, head to the doctor's profile page, and click on the Request an Appointment tab. Now up next, we're going to hear about the Mommy Makeover with plastic surgeon Dr. Robert Wilcox.
Well, Mommy Makeover is a term that incorporates recontouring and improving the body, in particular after one or multiple pregnancies.
Over the past 6 years, I've lost a lot of weight and have had a baby and just had a lot of imperfections that I didn't like about myself that made staying healthy difficult.
What a Mommy Makeover incorporates is usually a tummy tuck, which tightens the muscles and the skin and removes the lower abdominal stretch marks. And oftentimes there may be loss of breast tissue from the pregnancy and subsequent nursing, or there may be drooping in addition, in which case breast augmentation or a breast lift or the combination of the two is done in conjunction with the tummy tuck. And then there may be need for liposuction as well in, for instance, the hips or the thighs.
My concern is I work. I'm a working mom, so I knew I couldn't take off several months after each procedure, so that was a big concern of mine. And I'm a respiratory therapist, and I work 12-hour shifts on my feet, so I had to be able to be active when I came back to work. That was a big concern of mine. So Dr. Wilcox explained how he would divide up the mommy makeover that would best fit my schedule and my lifestyle. He definitely put me at ease over everything that would be done and what to expect after it was done and how it would look.
Looking in the mirror and not liking what you see, how more impersonal can that be? And now to look in the mirror and say, I not only look good, I look good for my husband. That's a knockout there.
Even going to buy a new pair of shorts or a sleeveless shirt. I used to wouldn't wear short sleeves or a sleeveless shirt, and it's just a freedom that you have to go think something's cute, try it on, and it does look cute. I am very pleased with the outcome and service that I got from Dr. Wilcox, and it is the best outcome that I ever could have thought.
For more information and to check out hundreds of videos, head to our website. It's bestdocsnetwork.com.
All right, Grace, time to head to our next best doctor. It is bariatric surgeon Dr. Scott Stowers from Bariatric Solutions, who has a unique way of helping his patients.
Initially, we had a lot of trouble getting patients that were from outlying areas taken care of as far as their adjustments for their bands.
When you adjust a lap band, what you're doing is you're accessing the port, which is located in your abdomen area, and you put saline in it, and it blows it up just like you would an inner tube. As the food goes into the stomach, in that, which we call the pouch, it has receptors. And with those receptors is what triggers to the brain that you're full. And by the lap band restricting and holding that food in that area, you will get a full feeling much quicker than what you would normally.
We had a fluoro machine because we do all of our adjustments with an x-ray machine, and those were extremely expensive, and I had to figure out a way to get those to the patients. At that point, we decided to put that in a mobile unit, or we call it a lap band wagon, to do adjustments for patients on site or at least in their area.
This is where we do the actual follow-up appointments and also do the fluoroscopy on the patients to make sure that their band is working and to see how much their band may need to be adjusted.
The fluoroscopy machine is like a live video. They drink barium. It allows us to actually visualize it going down the esophagus, in through the lap band and into the stomach. This gives us an idea of how everything is working inside.
It's just as sanitary, just as sterile. We use the same procedures as if we were in the emergency room or in the office.
Because follow-ups are so important to our patients' success, we've made it possible now for all patients, regardless of the type of procedure that they've had, to be able to do their follow-ups on board the lap band wagon, which makes it beneficial for the ones in Abilene, Amarillo, Waco, the different locations that we drive to. But we are the only practice in the country that has a mobile unit, and we're really proud to have this.
Experts say weight training should be done first because it's a higher intensity exercise compared to cardio. Your body is better able to handle weight training early on in the workout because you're fresh and you have the energy you need to work out. The Best Docs Network is all about doctors helping change people's lives. It's educational, informative, and real. Log on to bestdocsnetwork.com.
I never intended to have a facelift. However, I had married a gal for several years, and during those time I gave her lots of plastic surgeries. And Then I found out that she had, after she left, she actually got remarried, and a fellow showed me her picture on Facebook, and she looked, at 55, she looked absolutely wonderful. Just really good, and I thought to myself, you know, if I could pay the money for the plastic surgeries for her, I bet you I have enough money to pay for it for myself.
John is a very intelligent gentleman who was close to 70 years of age, and he wanted facial rejuvenation surgery, but he wanted a very natural look. He didn't really want to necessarily look that much younger. He wanted to look rested, and he wanted to look good, and that's what he was after, which was very realistic for a gentleman who's close to 70 years of age.
It is unfortunate that more men do not choose to get a facelift because it makes a tremendous difference in their appearance. They get their chin back, they get all the wrinkles taken out of their face, and they look younger, and obviously they're going to have more respect when they're younger.
There's many actors and other prominent figures in our community where the males have had facelifts, and they look like they've had a facelift. They have almost an unnatural look. In a gentleman, you have to be extremely careful because if you make him unnatural, you tend to feminize him. And I think the last thing a male wants is feminization of the face. They just want rejuvenation of the face. So I believe that we were able to achieve all that, yet giving him a very natural look to the point that he doesn't look like he's had facial rejuvenation surgery.
The surgery has given me a confidence to put myself on some of the dating services, the .coms, and the results have been excellent. I've probably had a different date at least once a week, maybe sometimes twice a week. And the number of people responding to me, I realized that they were younger and younger and younger, and typically the people that respond to me are aged somewhere between 50 and 55. And that's not bad for somebody 68. I'm very, very pleased with that.
How much sleep do you need? That varies from person to person, and different times of your life you may need different amounts of sleep. So how much do most people need? Well, some people need 3 or 4 hours. Those are the rare people. Some people need 10 or 12 hours. Those are rare also. Most people need 7 to 8 hours to get a healthy night's sleep. Now, during sleep, you go through cycles. About every 90 minutes, you get back into light sleep and then go into deep sleep. And so about every 90 minutes, you are in a lighter level of sleep. And that's why at about the 90-minute time frame, or a multiple of 90 minutes, is when you'll wake up to use the bathroom at night, or wake up to go get a sandwich or something. So at any rate, get 7 to 8 hours of sleep a night at least. And it is true, sleep when it's dark, don't sleep when it's light. Early to bed, early to rise makes a man healthy, wealthy, and wise.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
For more information about any of our outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. Right now, time to introduce you to our next best doctor. It is cosmetic dentist Dr. Guy Lewis, who upped a wounded warrior with a smile makeover.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is the majority of the time a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving, there was an SV bit on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was in Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner, and so he's seeing people in the clinic, and so then He's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile, and then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me. He's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. Specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
Acid reflux is a common condition, and you may already be on medications for heartburn. The trouble is, heartburn is only a symptom of the underlying problem, and taking medications to cover up the problem does nothing to correct it. Now there's a new procedure that restores the natural valve structure, keeping food and digestive enzymes out of the esophagus. You can stop the heartburn and the regurgitation, as well as the medications you've taken for years. For more information, call for an appointment or log on to dallasreflux.com.
A recent study in the Journal of Periodontology shows that 2 ounces of yogurt a day may protect you from gum disease. The typical container of yogurt holds 6 ounces, and the good bacteria in yogurt helps fight germs in your mouth.
Hi, and welcome back to the Best Docs Network. In the studio, we're joined today by Dr. Harvey Carter, founder of Carter Eye Center and one of the top LASIK surgeons in not only the Dallas-Fort Worth area, but in the country. It's a privilege to have you here, Dr. Carter. Thanks for joining us.
Thank you for having me.
Now, you were the first FDA investigator to perform LASIK surgery in North Texas. So you're obviously an expert on the subject matter. So I'd like you to talk to us just a little bit about LASIK surgery. If you would start off just by taking us through the process.
The process today is really just dramatic in terms of its ability to rapidly change someone's life in a matter of minutes. Today's technology is blade-free, all laser vision correction. On a surgery day, the patient comes in and they sit in a very comfortable room where their eye drops are applied. They get a light sedation with Valium or something like that if they want, chemical courage as it's called. Mm-hmm. They then go in the laser vision correction room, and in that room we have a laser that makes your flap. So you have a flap made in your cornea. We have another laser that takes your personalized prescription from your eye and lasers that prescription directly onto your eye.
Wow.
If your prescription was whatever it was in your glasses or contact lenses. It can be literally sculpted onto your cornea so you can throw away, hopefully, your glasses or contact lenses. You put the flap back and they go out, and the entire procedure from walking into the room to walking out of the room is usually less than 5 minutes.
Oh, wow, that's amazing.
Isn't it great?
Absolutely. And if a patient has LASIK surgery, will they be glasses free for the rest of their life, or is it possible that their eyes will regress and they'll have to have surgery again?
There are a variety of ways of doing LASIK surgery. LASIK in general will treat nearsightedness, farsightedness, astigmatism. So it will basically reduce or eliminate the need for glasses for anyone under the age of 40.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Hi, this is Dr. Malik. Did you know that there are many new non-surgical treatment options for aging skin? For more information, head to bestdocsnetwork.com.
For dry skin, incorporate more avocados into your diet. They're rich in monosaturated fat and vitamin E, both of which promote healthy skin. Try them on salads and sandwiches, and even in smoothies.
We've been using preferred imaging since 2001, since I started practicing here, and patients universally come back telling us what a great experience it was. I'm an orthopedic surgeon, board certified in orthopedic surgery and sports medicine. I do a customized knee replacement that is a special technique that is customized for the individual patient. So that knee replacement is based off of an MRI that the patient gets of their knee, their hip, and their ankle. And through that MRI, we feed that into a computer, and it creates a three-dimensional model of their whole leg. And that allows us to be much more accurate in the way that we do the surgery. So the MRI for that knee replacement technique is absolutely essential. It's a special MRI, and Preferred Imaging is specially certified and trained to do these special MRIs. Well, we love Preferred because they do a fantastic job for our patients. They get our patients in right away. They do a wonderful job at customer service and making sure the patient's comfortable through the whole experience, and really just guiding the patient from start to finish through that sometimes scary experience, and making sure that they are as comfortable as they can be. Well, MRI is a very integral part of an orthopedic practice because it's the best imaging test for musculoskeletal problems. So we use MRI quite a bit to establish a specific diagnosis, and that saves a lot of time and effort. You know, the quicker you can establish a diagnosis, the quicker you can get to the bottom of the problem and get it fixed. One of the greatest things about Preferred Imaging is that they have incredible hours, operating hours. They work from early morning till late at night and 7 days a week, and that convenience is an incredible thing for our patients because they don't have to miss work oftentimes, and they can get the MRI done right away, immediately, so that we get an answer to what's causing their problem, and we can get busy fixing it. We send patients to Preferred Imaging because we have full confidence in their ability to do a really good job for our patients, and they treat them well, and that reflects well on us.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the outstanding doctors in the Dallas-Fort Worth area that help change people's lives. And the good news is, Grace, for more information about any of these great doctors you see on today's show, you can head to the website, bestdocsnetwork.com. That is bestdocsnetwork.com.
And thank you for tuning in. And if you have a question or comment or a life-changing story, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.